Energy. Kilocalorie is the amount of heat required to raise the temperature of 1 kilogram of water to 1 degree Celsius. How to calculate energy. The basal metabolic rate, thermal energy of food, and thermal energy of fat. The basal metabolic rate, known as the BMR, includes to continuous metabolic process that sustains life. Example is breathing. The basal energy varies through body size, age, growth, and thyroid activity. Lean tissue is more active. The liver and brain use 4% of body mass. Lean body mass goes down 2 to 3% every 10 years. Male have higher BMR than female because men have more muscle. Pregnancy increases the BMR. Fewer raises BMR 7% for each degree of Fahrenheit. Exercise raises the metabolism 30% and lasts for a few days. Metabolism goes down after starvation. The thermal effect of exercise accounts for 20% of the energy your body uses. The second largest component of the total amount of energy your body uses daily and is the energy spent in operating voluntary muscles. For some athletes, it may be the main use of energy. Thermal effect of food. The body speeds up metabolism in response to eating a meal. Thermal effect of food is energy used for digestion, absorption, transportation, and storage of nutrients. Thermal effect of food is about 10% of the total energy needed. Three steps to calculate energy. Body weight in pounds divided by 2.2 equals the body weight in kilograms. The body weight in kilograms times 0.9 times 24 equals the basal metabolic rate. The basal metabolic rate times exercise factor equals thermal effect of food. The BMR plus TEE times 0.1 equals the thermal effect of exercise. Exercise and daily activity chart. Very light, female is 0.3 and male is 0.3. Light, male is 0.5, female is 0.6. Moderate, female is 0.6. Male is 0.6, female is 0.7. Heavy, male is 0.9, female is 1.1. Exceptional, male is 1.2, female is 1.4. Overweight, 10 to 20 over ideal body weight. 10 to 20 pounds over ideal body weight makes you overweight. 35% male and 41% female are overweight. 37% male and female are obese. You are considered obese if you're 20% above the ideal body weight. Health problems with overweight: blood pressure high, stroke, blood LDL, coronary artery disease, diabetes, cancer, gallbladder disease, which causes gallstones, arthritis, heart problems, abdominal area. Gout. Gout is too much IU from the amino group Liver converts to urea, released through urine. Not fast enough, the urea crystallizes and accumulates by plus joints. Upper respiratory problems, skin disorders, menstrual, ovarian, and pregnancy problems. Excessive fat in the abdominal area is more dangerous than the buttocks. Underweight. Less than recommended body weight. The relationship between mortality and the body weight is presented by a U-shaped curve. Problems with underweight. Inadequate immune response, loss of menstrual function, loss of strength and endurance, inability to do aerobic weights, decreased feeling of well-being. Various standards that are used to determine weight goals. Cultural is number one. 39% of women and 25% of men trying to lose weight in America. Number two, height and weight table. Number three, the body mass index. If you're 19 to 25, under 35 is good. 21 to 27, over 35 is good. BMI 30 plus is obese. Number four, waist to hip ratio. Women 0.8, anything over 0.8 is overweight. Male is 0.95, anything over 0.95 is overweight. Underwater, number five is underwater weighing. Number six is the skin fold calipers. Not very accurate in weighing the absolute percentage of body fat, but can accurately estimate increase or decrease of fat over time. The ultrasonography, number seven. Each pound of excess body fat represents the consumption of about 3,500 calories more than the person has expended. Factors that determine hunger and satiety, which means full. Internal factors. Number one, brain factors determine the consider the concentration of circulating nutrients. I'm going to read that again. The internal factors. Number one, brain factors determine the concentration of circulating nutrients. Number two, a feeling of fullness in your stomach and intestines. Number three, fat and dietary fiber to have extent protein. Slows down the passage through the digestive system, so increased satiety time. The desire for food intake increases 10 days before menstrual, but this may be offset by increased metabolic rate. External factors. Number one, palatability. Food that tastes good and can eat beyond the amount that satisfies hunger. Number two, increased desire to experience the sensory accessory to food contribute to excess body weight. Number three, temporal cues, certain locations, specific sounds, various social customs. Number four, restrained eater may become more responsive to internal cues and eventually eat more than people who are constantly trying to lose weight. The energy output, metabolism. Number one, the BMR, which is the basal metabolic rate, can vary 30% from average. Number two, thyroid hormone level. Number three, level of activity. Number four, obese people may use less energy for thermal effect of food. Number 5, trained athletes may use less energy for thermal effect of exercise. Genetics. Twins have stronger tendencies to weigh the same even if they're reared apart. Number 2, overfed pairs of twins have similar patterns of regional body fat. Number 3, the body and BMR in adults who were adopted when infants resembles the bio parents more than the adoptive parents. Energy input is mainly determined by culture. Energy output is mainly determined by genetics. Theories about weight gain. Number 1, the hypertrophic obesity, which is fat cells 2 to 2.5 larger than normal due to biochemical responses. Number 2, hyperplastic obesity. During a period of growth or excessive weight gain, the number of fat cells increase permanently, makes losing weight very difficult. Number 3, the set point theory refers to the predetermined level of fatness that is maintained and that eats according to hunger. Theories about weight loss. Pregnant women, lactating mothers, children, people over the age of 65, people with certain medical or psychological problems should not attempt to lose weight without physician's guidance. Number 2, more than dieters regain the weight. Even a small weight loss have health benefits. Best weight loss program requires commitment to permanent lifestyle change. Number 2, lose more than 1 pound per week. Number 3, use combination of improved eating habit, moderate exercise, and appropriate support system. Number 4, reduce total fat intake to 20 to 25% of kilocalories. Number 5, your food should provide fewer kilocalories but all the nutrients. Water. Fat is 20 to 35% water. Muscle is 72% water. Children have higher percentage of water than both male and female. Industrial fluid, the fluid in tissues. Blood, 90% of water. Bones, 25% of water. And teeth, 10% of water. Bottled water. Bottled water doesn't have fluoride. It's not checked for industrial or agricultural pollutant. It comes from private wells and it may be contaminated. Lead can enter water from pipes. Functions of water in the body. It's an active participant of many chemical reactions. Water is the best solvent. Water is lubricant in the synovial joint and serous fluid. Protection. It cushions around joints. Shock absorber inside the eye, the central nervous system, and pregnancy. It's cushioning. It transports blood. It regulates body's temperatures, sweating, and bases dilation. Concentration or dehydration process, how to make large molecules. Water also hydrolyzes to use water to break down the protein. It maintains the blood volume, and water is a part of spit, tears, keph, blood, and cytoplasm. The solvent times dissolvent, and solute minus dissolvent equals solution. Diffusion, osmosis. Cell planted in different solutions. Isotonic solution. Hypertonic solution has higher concentration of solute in the cell. Hypotonic solution has low concentration of solute in the cell. Water balance. The water source: drink 4 cups, food 4 cups, metabolic waste 2 cups. Water excretion: kidneys 5.5 cups, skin 2 cups, lungs 1.8 cups, feces 0.7 cups. Factors to increase and decrease perspiration and respiration: high temperature, high altitude when the air gets dry, cold places, dry environment like desert, and heavy exercise. Dehydration results in decrease in blood volume. It decreases oxygen delivery to the tissue. It increases respiration. The water loss by respiration increase. The cardiac output decreases, and then the increase in pulsate turns to fatigue and headaches. High salt in blood results to 2 things. Salt pulls out water from kidneys into the blood and causes high blood pressure, and an antidiuretic hormone is released by causing and reabsorbing water back to the blood. The result is high blood volume, high blood pressure, and decreased urine. Low blood pressure. When the volume is low, hormones cause blood volume to be low. Kidney secretes salt back into the blood so water can be reabsorbed back into the kidney. Thirst. Thirst is determined by the hypothalamus. According to concentration of salt in blood. Number 2, blood volume. When low, you desire water. Number 3, dryness of mouth and throat. Ill people and elderly need more water than the census indicates. Dehydration. Diarrhea and heavy sweating causes dehydration. At 4% water loss, physical problems occur. At 30%, it drops in muscular endurance. 10 to 11%, delirium and kidney failure can occur. 10 to 20%, death occurs. Endurance athletes can produce up to 2 liters of sweat in 1 hour and needs replaced by oral hydration. Ill people need to drink a lot of water. You need to drink 1 liter of water per 1,000 calories expended. It takes 3 days to replace water loss if you only drink according to thirst. Cold water between 40 to 50 degrees Fahrenheit is best for enduring exercise and absorbs faster. Put carbohydrate in water while exercising. 20 liters of water causes water intoxication. Ions don't need replaced unless you work out more than 4 hours. Vitamins. Vitamins can be destroyed by long-term storage in heat. The 3 types of vitamins are water-soluble, fat-soluble, and the B and C complexes. Fat-solubles. Fat-soluble is carried in fat and absorbed through the lymphatic system. They cause toxicity. Vitamin A. Vitamin A plays a role in cofactor in the parathyroid hormone. The parathyroid hormone puts calcium into the blood. The vitamin A is important to in cerebrospinal fluid, better known as CSF. CSF protects the nervous system, the maturational of epithelial cell. Vitamin A is a weak antioxidant. Vitamin A helps with vision and night vision. The deficiency of and not getting enough vitamin A causes poor night vision, decreased CSF fluid or CSF deduction, hypothyroidism, which is too little calcium, when too little calcium is released in the blood, and hypocalcemia, low calcium level in the blood, failure to maturational epithelial cell. Vitamin A excessiveness. Overproduction of the CSF results in headaches, birth defects, hyperparathyroidism, which is the release of too much calcium in the blood, which causes kidney stones. The sources of vitamin A is animal product food, eggs, butter, milk, liver, and meat. Vitamin D. It structures teeth, bones, and stimulates absorption of calcium and phosphate. The deficiencies: rickets in children who lack vitamin D in food and renal defect. Osteomalacia, which is softening of bones. Vitamin D excessiveness: hypercalcemia, kidney stones, bone pain, growing pain, psychic overtone, and the sources are milk, and body makes its own vitamin D, and the sun. Vitamin E, a main antioxidant in the body. It protects against free radicals, prevents cancer, prevents Alzheimer's, prevents autoimmune disease, and prevents cardiac problems. Toxicity interferes with anti-clotting medication. The sources is veggie oil, seeds, nuts. Vitamin E is destroyed by light and heat. Vitamin K regulates blood clotting, assisting transport of calcium throughout the body, forms some of the bone's proteins that makes bones stronger. Newborns are given a shot of vitamin K. Sources is the gut and bacteria. Deficiencies: clotting, effect of bones, make them weak, interfere with calcium transport. Vitamin C, the function is water-soluble antioxidant. It helps with absorption of non-hemo iron, collagen formation, bone formation, growth, helps resist infection. Deficiencies is scurvy, which is bleeding of the gums and teeth falling out, anemia, which is a lower RBC count, atherosclerosis, heart disease, fragile bones, which is collagen needed for bones, muscle degradation, depression, and rough skin. The toxicity comes mainly from supplements. Causes nausea, abdominal cramps, diarrhea, headache, and fatigue. The sources of vitamin C are dark green veggies, berries, cantaloupe, and tomatoes. Thiamine, which is a B complex, B1, part of the coenzyme that's involved in energy metabolism. Deficiencies: alcohol prevent the absorption for B1 to absorb in the blood. Burby. Or, yeah, it means I can't. It damages to the nervous system, damage to the heart muscle, damages the muscles, damages edema, muscle wasting. The RDA is 1.2 milligrams per day. Sources is whole grain pork, and it's required by law to add